Everyone. Today I am going to present the video presentation regarding the drug Levonorgestrel. Levonorgestrel is also called Plan B. It is the hormonal first-line oral emergency contraceptive pills which helps to prevent pregnancy. It prevents ovulation by closing of cervix for prevention of passage of sperm. It helps to decrease chance of being pregnant by 57% to 93%. Let's have a look at the pharmacokinetics of levonorgestrel. It is divided into four parts, which is absorption, metabolism, distribution, and elimination. In the absorption, the oral progesterone increases plasma level within 150 minutes. When 200 mg progesterone is used, the median change in plasma level from baseline is 24%. When taken over 5 days, the highest level of progesterone occurred within 4 hours of last dose and remained raised for 96 hours. In the distribution, the approximate volume of levonorgestrel is 1.8 liter per kg. Levonorgestrel is bounded by plasma protein, which is about 98%. It includes 50% to albumin and 48% to SHBG. In the metabolism, following oral administration of levonorgestrel daily for 5 days, plasma concentration of propaganol, 3-alpha glucuronide, 20-alpha dihydroprogesterone, 17-hydroxyprogesterone, 5-alpha pregnenolone, 5-beta pregnenolone increased. In the elimination of a single oral dose levonorgestrel, which is 0.75 mg, was 27.5 plus 5.6 hours. Approximately 45% of levonorgestrel are excreted in urine and approximately 32% are excreted in feces, mostly as glucuronide conjugates. Let's have a look at the pharmacodynamics of levonorgestrel. Levonorgestrel binds to the progesterone, that is agonist of the progesterone receptor, which stimulates to initiate transcription and increases synthesis of certain proteins in the nucleus of the target cell. When used as contraceptive, progesterone thickens cervical mucus to impede the passage of sperm and change endometrium, reducing the potential for implantation. They act on the hypothalamus and surge pituitary LH surge and may inhibit ovulation. The mechanism of action is mainly local progesteronic effect within the uterine cavity to regulate endometrial estrogen and progesterone receptors, resulting in an antiproliferative endometrium. It is 93% efficient when used within 72 hours after unprotected sexual intercourse. Here is the humanoid model given in the picture, which we can see the process of progesterone which inhibit ovulation. Let's have a look at interdisciplinary team. Most of the drugs fall under the Schedule 4 drugs, which can only be obtained with the prescription, but some of the medication is also under the Schedule 3 drugs, which can only be supplied by pharmacists in a pharmacy. The authorized healthcare professional which can give this drug are doctors, registered nurse practitioner or midwifery nurse practitioner, pharmacist, community health practitioner, and so on. To promote the effective use of the drug, the education of risky behavior during the sex and the efficient plan to avoid the side effect of the drug should be provided to the patient. As a counseling of the levonorgestrel, the two of the questions I have present is how the levonorgestrel pills is taken. The answer is, if the pills are taken by 2 tablet products, so 1 tablet should be taken within 72 hours after the unprotected sexual intercourse and the other tablet is taken 12 hours later. Levonorgestrel tablet work efficiently if it is taken as soon as possible after the unprotected sexual intercourse. The other question is, what measures should be applied after levonorgestrel is taken? The answer is, after taking it, one should continue to use birth control and protection method when having sex to prevent from pregnancy, and should take a pregnancy test and get screened for sexually transmitted diseases and do as per the advice of medical professional. The side effects of levonorgestrel are dizziness, vomiting, nausea, tiredness, and so on. Here are the sets of questions which helps to test the knowledge. And I have also given the reference from the respective resources. And lastly, thank you everyone for your time and cooperation. I appreciate that.